Alright everyone, if you're prepping for your MBBS exams, you already know that leprosy is a super high-yield topic, so this explainer is designed to give you exactly what you need to know, and fast. Okay, let's dive right in. So here's our game plan. We're going to tackle this in 4 key parts. We'll start with the basics of how we classify leprosy, then we'll get into the 2 polar forms of the disease. That's a classic exam favorite. After that, we'll cover the complications and deformities, and we'll wrap up with Lepra reactions, which are absolutely crucial to understand for your clinicals.
First up, classification. To really get a grip on leprosy, it helps to see how the classifications have evolved over the years because it all funnels down to the simplified system we use in practice today.
Now you might see these older systems pop up, Ridley, Jopling, Madrid, the Indian classification, and they're definitely good to have in your back pocket for a Viva or an oral exam. They show you the whole spectrum of the disease. But in the real world, for actually managing a patient, it all boils down to one crucial clinical classification.
And this is it. It all comes down to this: Bacillary or PB versus multibacillary or MB. This single distinction determines the entire treatment plan. Bacillary, Posse means few, so think 1 to 5 skin lesions, no nerves involved, negative smear. Multibacillary is the opposite, and the key takeaway here, and I really want you to remember this, is that if a patient meets even one of the MB criteria, like any nerve involvement at all, they are automatically classified and treated as an MB case.
Okay, so now let's see how this PB versus MB classification fits into the 2 extreme ends of the disease spectrum. This contrast between tuberculoid and lepromatous leprosy is a classic must-know high-yield exam question. They love asking about this.
And wow, this slide just perfectly illustrates that difference, doesn't it? I mean, look at image A on the left. That's lepromatous leprosy. You see all those multiple nodules? They are just teeming with bacteria, a very high bacillary load. Now, contrast that with image B on the right. That's tuberculoid leprosy, just a single, well-defined patch where the person's strong immune response has managed to wall off and contain the infection.
Okay guys, this table right here, this is pure gold for your exams. It connects everything we've been talking about. And you can see a pattern, right? Lepromatous is multibacillary, lots of lesions, nerve damage happens late, and the immunity is low. Tuberculoid is the complete opposite. Bacillary, just a few lesions, nerve damage happens early, and the immunity is strong. Let's dig into that immunity link for just a second.
So, the simplest way to remember all this is to realize that the patient's cell-mediated immunity, their CMI, is the ultimate deciding factor. If their CMI is low, the bacteria basically wins, leading to widespread lepromatous disease and a negative Lepromin test. But if their CMI is strong, the body wins by containing the infection into that localized tuberculoid form, which gives you a positive Lepromin test.
So what happens when leprosy goes untreated? Let's look at the long-term impact. The nerve damage is really the central issue here, and it leads to some very characteristic and often devastating deformities.
A quarter. Just think about that. 1 in 4 untreated patients will develop permanent deformities. That's a staggering number, and it really underscores why early diagnosis and consistent treatment are so incredibly critical in preventing what can become a lifelong disability.
Now, for your exams, a really great way to remember these is just to group them by location. It makes it so much easier. For the face, you're going to think of leonine facies, that classic saddle nose deformity, and the loss of eyebrows. In the hands, nerve damage leads to claw hand and wrist drop, and down in the feet, foot drop and those chronic, hard-to-heal plantar ulcers are very common.
All right, and finally, let's cover the curveball in managing leprosy. These are the acute inflammatory episodes known as Lepra reactions. And they can be tricky because they can happen before, during, or even after treatment is completed.
Okay, the single most important thing to understand here is that these are immune-mediated events. I'll say it again, they are not a relapse or a sign that the treatment is failing. What's happening is a sudden, dramatic shift in the patient's immune response, and these reactions are divided into 2 main types.
And this table breaks it down perfectly. You can see type I, which is called a reversal reaction. That's a type 4 delayed hypersensitivity reaction, and you'll typically see it in borderline patients. But then you have type 2, also known as ENL, which is a type 3 immune complex reaction. This one happens in lepromatous patients, and it shows up as these classic painful red nodules.
Okay, and here it is, an absolutely incredible memory trick, so you never ever mix these up on an exam. It's the rule of 5. Just look at this. A type 1 reaction is a type 4 hypersensitivity. What's 1 plus 4?
It's 5. And a type 2 reaction is a type 3 hypersensitivity. What's 2 plus 3? It also equals 5. It's so simple, so effective, and honestly, you'll never forget it.
So let's do a quick knowledge check to lock this in. Which reaction is that type 3 immune complex response that you see in Lepromatous patients? Well, think back to our rule of 5. The one that adds up with type 3 is the type 2 reaction, or ENL. If you got that, you've totally nailed this concept. And that's it for our high-yield review of Leprosy Part 1. I really hope this helped. Now go and study smart.